Hello, I'm Aline, head of behavioral science at Pattern Health, and I'm also a researcher at Duke University. I've worked alongside behavioral economist Dan Ariely for more than 10 years now, so I've had a little bit of practice getting people to engage in healthy behaviors, and that's what we're going to focus on today. My goal is to help you think about how you might design effective digital health programs using behavioral science. So imagine a world where everyone took their medication on time, every time, everyone exercised for 30 minutes a day, 5 times a week, and everyone chose the apple instead of the pizza. The reality, as you know, is that people don't reliably adhere to these healthy behaviors, among others. And as a result, this not only leads to poor health outcomes, but accounts for half the annual cost of healthcare. The vast majority of health behavior happens outside the doctor's office, in people's homes. It's individuals deciding on a daily basis whether or not to take their hypertension medication. Adherence is a behavioral issue, and it's one that at Pattern Health, we've put a lot of energy towards helping people like you create digital health programs that can bridge this gap. We want to help patients and consumers do the things that they know they should do to adhere to their health programs. And by engaging patients through our digital health programs, we can bridge this adherence gap to both improve health outcomes and lower the cost of healthcare. There's a tremendous opportunity at this sweet spot where behavioral science and digital health intersect. While behavioral science allows us to understand the person within their environment, digital health technologies provide a means for reaching them. People already carry their phones with them everywhere. They're these perfect little intervention devices. And these technologies allow us to help people at the right place at the right time. And that's really key. Our job is to work at this sweet spot to help you design digital health programs for engagement and behavior change. And these two goals are really at the crux of everything that we do. And engagement is important not as an end in itself, but without engagement, our interventions would have little effect on the people using them. Just as former Surgeon General observed that medications don't work in patients who don't take them, naturally, the same is true for engagement in digital health programs. We care about engagement because it gets us to behavior change. And it's important that we pick a behavior and not an attitude. This is because while interventions directed at changing attitudes may actually successfully change attitudes, they don't necessarily change behavior. So if it's behavior that we ultimately care about, if we want every American to get a flu shot this season, or if we want our diabetic patients to check their blood glucose before and after meals, if we care about behavior change, then we need to focus on that rather than trying to change attitudes or even providing information. This is because of what behavioral scientists call the intention-action gap. We can all probably recall a time when we knew that we should do something healthy, like exercise, so there's no lack of information, and we fully intend to do so. We have a pro-exercise attitude, yet we didn't follow through on that behavior. We didn't actually go for that jog. This is what we call the intention-action gap, this gap between intention and action. And this is why we want to design for behavior change rather than attitude change. Once you know what behavior you're trying to encourage, you have to decide how to measure it. So there's lots of activities that we can track and measure, whether through patient-reported outcomes or passively collected through devices. And so here you can see an activity to check your heart rate, take a survey, take medication, exercise, check weight. Of course, this is just the tip of the iceberg in terms of types of activities. If you can dream it, then we can probably do it, right? We can also measure through surveys, and we don't have to stop with measurement. We can actually use these inputs to trigger an intervention by setting up rules or triggers that respond to all sorts of data. So user properties, biometric measurements, survey responses, task adherence, and so on, we can really personalize the experience. So if you see that a patient's blood pressure crosses some dangerous threshold, you can automatically send a notification or customize that user's program in response. Now, I want to share some best practices for program design to help you think through how to create the most effective digital health program. To do that, we have to start with choice architecture. Choice architecture is the foundation of designing for behavior change. And I'm not talking about designing houses, I'm talking about designing decision environments. And the environment can be as simple as the design of an app or a form. But let me give you an example of what I mean by choice architecture, because this might not necessarily be part of your vocabulary. Here, some researchers wanted to see if they could get people to switch from branded to generic medications. And this, they hoped, would help them save costs without having any sort of detrimental impact on outcomes. So this is the before picture, before they tried out their behavioral intervention. And so you can see what percentage of prescriptions were prescribed as generic beforehand. And this is the after. As you can see, something happened here. Generic prescriptions jumped up almost 100% across the board. So think to yourself, what could they have possibly done to get these results? How did they achieve this massive jump in generic prescriptions in just 2 months? Did they double physician salaries if they prescribed generics? No, all they did was change the default. Their intervention was absolutely free and unbelievably simple. They changed what was prescribed by default in their EHR. And before, the default was to fill whatever the doctor ordered, whether it was branded or generic. Now they changed it so that the default would be generic and the doctor would have to take an extra step, a very small step, checking a little box when they were ordering to override this and prescribe branded. And in the 2 years since it was implemented, it saved the health system $32 million. Just no small change. And all they did was make it easier for doctors to do what they already wanted to do. So we want to do as much as we can to design with this idea in mind, to make it easier for people to do the right thing. So the first thing we want to do is get rid of all unnecessary steps and choices. Then we want to default everything that we can. And as an example of that here, you can see on the right, the Pattern app automatically sets a routine for scheduling notifications. So this is based on a typical day for the average person, but it also allows people to easily change it if the average doesn't suit them. They can opt out of that. And finally, when the user has better information than you, if they really have to make a choice, then give them an active choice. So would you like to do yoga today or lift weights? Now, at the risk of oversimplifying human nature, we could argue there are two primary forces that can explain quite a bit of human behavior: friction and fuel. Now, friction is anything that gets in the way of performing a behavior. Friction can be anything that takes too much effort or is inconvenient. So say filling out forms, having to mail something in requires postage and so on. If you give people too many options or too much information, this can easily lead to decision paralysis or information overload. And it can even take this sort of invisible form of gravity, the status quo. Often it's easiest to do something that we've always done, even if it's not the right thing or the thing that's in our best long-term interest. Now, fuel, on the other hand, makes a behavior more likely, more appealing. And so fuel can take the form of incentives, financial or not, social reward. It can even just be something like a fun experience. And beyond friction and fuel, we've used everything that we know from behavioral science to give you a head start. So we've done this by designing the entire Pattern Health platform with the principles of human behavior in mind. So what are these little quirks of human nature and how can we use them to get people to do the things that are in their best interest? And I'll give you some examples of how we've done this. So in Pattern Health, people commit to their digital health program and they sign their name in the app to seal the deal. So as a patient, you not only review your plan so the elements are more clear, you're also signaling to yourself the importance of sticking to your plan when you're signing to commit. We can also tie points to behaviors as incentives, and we know from our research that it's more effective to start with points that are lost when tasks are missed than it is to start with no points and then gain when tasks are completed. And this is based on a concept called loss aversion. We're much more motivated by the prospect of losing what we have than we are excited about gaining the equivalent amount of that same thing. Another feature we have is the Care Circle chat, which is based on the idea of accountability buddies, or leveraging our social contacts, our real life social networks to help people stick to their goals. Now, patients select people who care about them, people they get to choose to invite, to bring into their care circle. So these can be friends, other patients, coworkers, caretakers, and so on. And then this group, this care circle group, gets notified by that patient's activity so that they can lend support. So when you get a notification that your Uncle Poe has missed his medication, for example, you can see that right here, you can check in to see whether everything's all right and offer to help. We also have the ability to supercharge patients' best intentions. In a study with heart failure patients, we asked people to decide in advance when they would like to take a weight measurement later that day. And we call this an implementation intention. It's essentially an if-then scenario that the user sets up to serve as a sort of better kind of reminder, a souped up reminder. And so the patient decides when they want to step on the scale so that when that thing happens, say, after they eat dinner, they're more likely to remember to weigh themselves. They think, oh, it's dinner, and I said after dinner I would take my weight measurement, so they step on the scale. In our research, we found that the implementation intention was twice as effective at getting heart failure patients to take a weight measurement than not setting one. Now, an important thing about motivation, it has to be really clear to users what success means, how their actions can get them there, which means providing them with feedback and very simple to-dos. So that's why the dashboard of the mobile app is basically a smart interactive to-do list. Here are the 4 things that you need to do today, and so far you've done none of them. To supplement the to-do list is a daily overview of progress, and users can choose to track their progress through a meter, which you can see here on the right, or a virtual pet. And both of these methods help patients keep track of where they are in relation to their goals. So this is the virtual pet, and his state responds to the user's task status. So celebrating successes, hiding from near misses, becoming sad when tasks are missed. He's a generally happy turtle, but if you behave well, then he'll be happy too. So you can see here that I've named my turtle Virgil, but when people actually commit to a program, if they choose the turtle, they get to give it their own name. And this we found both in research and from anecdotal stories of our users just telling us, this makes them much more attached to their virtual pet and more willing to engage in healthy behaviors to keep their turtle happy. So those are just a few examples of some features that we have to help design for behavior change. By taking advantage of this sweet spot with the behavioral science fueled digital health platform, perhaps we can work together to get to that world where people do reliably take their medication, exercise, and eat healthy. Thanks very much.